Hi everyone, it's Amanda with West University Moms, and I'm here today with Dr. Mclaughlin, or Dr. Mac, at Elite Care in Rice Village. We wanted to just quickly introduce the doctor and just ask you if you could tell us a little bit about what Elite Care is doing right now in these times.
You got it. My name is Eric Mclaughlin. I'm an emergency medicine physician, and I've been associated with Elite Care right here in Rice Village ever since the very first day we opened. I worked one of the very first shifts, and I just want to thank all of you for letting me share this time with you. Thank you, Amanda, for arranging this, and I'm here to kind of answer any of the questions you have about all the things that we do at Elite Care, including this scary new COVID-19 that everyone's hearing about. As many of you might already know, or many of your listeners and viewers might know, we have been around since 2009. We are a full-service emergency room, not an urgent care, and everybody always wants to know, what does that mean? The shortest way to answer that is Elite Care does everything a big hospital does, but we've taken that big hospital emergency room and pulled it out of that big box, and we've put it closer to the homes of our community members. We've been able to, because of our small footprint, we've been able to create smaller size emergency rooms that create better access. And I believe that the best emergency care is the care that's closest to you when you need it. When people have emergencies, those seconds and minutes really matter, and trying to arrange parking and thinking about the hassle of those big medical center emergency rooms, people just don't want to do that, and that's a waste of time. So Elite Care is everything you get in a full big hospital emergency room without the big hospital hassle. We can do everything from belly pain to head trauma to sprains and lacerations and all the kinds of things that a big hospital would do. We take care of heart attacks, strokes. When people need additional care that we don't offer here, such as surgery, or if they are going to have a lengthy hospitalization, through our community partnerships with St. Luke's, Herman, Methodist, all the big name brands, and any hospital in the area, we can arrange to transfer patients to those other locations to get the additional care that they need.
That's amazing. That's incredible. So who should go to see you and who should not? Like, how do you decide? I mean, if it's a break, or your child falls off a bike, they would come see you. If you have a cold or you're feeling sniffly, that's not something that would require a visit. Is that right?
That's right. Very good question, and you are spot on. We don't want people to use the emergency room for things that are better taken care of in an urgent care or in their primary care doctor's office. When those resources aren't available, patients may not have any other choice. If they believe they're having something critical or something emergent, they need to come to us and see us. Our doctors understand that many patients might come into our lobby area and register, and they may begin and engage with our doctor. And when the doctor finally realizes, oh, this patient has something relatively minor, it's their responsibility to inform that patient, you don't need care from an emergency room today. And then we'll arrange to get that patient to the appropriate care, either by calling their primary physician ourselves or calling the urgent care that might be nearby and asking, hey, is there any wait there? We've got a patient we'd like to send right over. So we don't just screen people and then send them out to the street. We try to arrange follow-up and keep it streamlined, because even the way we handle patients who are leaving our facility, we try to do that in an elite, very professional, very courteous manner.
And then how are you dealing now with just sanitizing the office, and what, I guess, new precautions have you been taking?
I think everyone is finally realizing that respiratory illnesses are serious. And as unfortunate as this situation is going to be and has been, we're all going to take a new look at greater levels of hand washing. We're all going to be conscientious about our coughs and sneezes. Social distancing is not going to go away as a result of this. And what we've done at Elite Care to make sure that we are prepared and beyond, we have hand sanitizing everywhere in the facility like you can't imagine. We have signage all throughout the facility reminding patients of covering their cough and hand washing, et cetera, et cetera. And one of the greatest things we've done to keep emergency medicine safe For all the people who are going to still come into our emergency room with those non-respiratory complaints, those broken body parts, those bleeding body parts, those very painful parts of their body, all those things that haven't taken a rest just because COVID is here, we've created a special pathway just for respiratory patients so that they can get identified even before they walk through our front door. They get a mask, they get their hands sanitized, and they go to a separate entrance so that they never interact with the patients who are still coming here with non-respiratory emergencies. And I think that was a brilliant move on behalf of our medical director, Dr. Aaron Schwartz, and our administrators, Richard Burton and David Barrett. They've been very instrumental in making sure that respiratory patients go this way,
Yes.
all others go this way, and they should never meet.
That's incredible. That's incredible that you're able to do that.
We think that's just responsible, and if we hadn't been thinking about that before in all the years past, that we should have been doing that as a nation. We really should have been keeping respiratory patients in different parts of the emergency room. Now we're doing it, and that's what I'm really excited about. We're finally keeping contagious illnesses away from people who certainly don't want to pick up something new because they went to the hospital.
That's definitely a concern, and that's great that you're being proactive. We would love to see the facility if you'd like to show us around.
Yeah, I'll walk you through. There are a couple
Great.
of patients in back right now, so I'll kind of aim the camera away from their areas so there's no privacy now. So let me see if I can flip this around. Okay, so I'm kind of back in the administrative area. I'm going to walk out into the lobby where you'll see the back side of a big bulletin board. And I'm going to go out in front of the building so you can see just how our patients now arrive when they come into the facility. So here we are, Rice Village. It's kind of dead out here.
Yeah.
There's someone who's not staying at home. Okay, so here's our facility. Everybody recognizes us right across from Pier 1 that just went out of business. And as patients walk up to the front door, assuming that they're not having an immediate emergency and they don't have, and if assuming they have some time to read, they're going to see this little plaque that says, "Hey, respiratory patients, before you walk in this door, pick up this registration packet." And they'll get that inside here. And inside the registration packet, I don't want to contaminate it, but there's a registration form, a surgical mask, and a pen.
Nice.
And there's a small little vial of hand sanitizer in there. So they can take that registration packet, they go out to their car, and they call our main number. And our number is listed on that registration packet. So they go back out to their car, they call us, and they say, "Hey, I've put on my mask, I've washed my hands, and I'm filling out this registration paperwork. I think I have a cough, a cold, a fever, sore throat, whatever it may be." That very friendly receptionist is going to instruct them to drive their car around to the back. I can't show you the back right now. Around to the back of the building. So it's just right over on the other side. Everybody knows the back of the building where the Children's Assessment Center is. And they're going to enter our building through a separate entrance. We've created a bubble to protect all the air that flows through that back entrance from getting to the rest of the emergency room. Now, just in case patients didn't read that message out there and they walked in, there's this big bulletin board standing right here. There's Gabby, our friendly receptionist right back there. If they didn't read the first one, they can't miss this one. And it tells them to go to a separate area over here.
Wow.
Similar kind of message. If you have a respiratory illness, first, sanitize your hands, open a packet, then fill out your registration, but not until your hands are clean and your face is covered. That's for those who escape through and don't follow those other instructions, or who don't feel like they should go back out to their car. They might have a more immediate concern, and our front desk people are trained to know how to recognize someone who's having shortness of breath,
Right.
chest pain, or is bleeding. They're not going to make them sit in their car. That would be ridiculous.
Yeah, that's smart.
So assuming, hey, there's Dave. So Dave just came from our bubble area. So if a patient goes around to the back of the building, our staff will greet them through this bubble. This is kind of like one of those zip walls. I'm not going to go back there because I don't have on full protective equipment, but only the staff, once they've put on all this protective equipment and gowns, gloves, masks, booties. Once they've got all that on, then they can go back through that bubble and interact with that patient back there. So that
That
bubble
is
is
incredible.
keeping everybody else in the emergency room safe. Right now, the big hospitals are so packed. Patients shouldn't be hanging out in those waiting rooms over there. It's just not safe. Everybody recognizes our kind of achievement wall. And if you've been here as a patient, knock on wood if you haven't, this is our main treatment area. Dave Barrett, Ethan, some of our great nurses. Our full service laboratory where we can process specimens. People want to know, are you doing COVID testing? The answer is on a limited basis. We're able to test for COVID. We send those tests out to the local health department or testing agencies where they will process them, and we get the results in about a day or two. We are not doing testing right here, though. We can't give you the results of a COVID test.
Mm-hmm.
We have a room that's just for kids and their parents.
Oh, that's
try
sweet.
to make that look a little
Oh, that's
calming
fun.
and a little more reassuring. When pediatric patients come in, our staff are all super trained to know how to be reassuring and speak the right kinds of words that kids like to hear.
Perfect.
We have a bathroom that is designated for all normal patients, and then we have a second bathroom that respiratory patients use. And that's just another way that we've tried to keep things kind of separated and safe, especially during this time. Okay, so there's only one patient on this side right now, and there's another patient in back behind our bubble. Everybody knows the Children's Assessment Center, and a lot of us know about the Hanover building where the Zoe's is. Gotta love Zoe's. I eat there too much. And here's our back parking lot. Back parking lot of Elite Care, 24-hour emergency center. There's our ambulance entrance. That's where the vehicles pull up and pick up our patients and take them away to surgery or lengthy hospital stays. And then just around the corner, right here, here's our respiratory entrance. And I'm gonna see if I can get in. So there should be a sign. There it is. Respiratory patient entrance. Okay, let's see if we can get in. Nope. As I expected, I'm not a respiratory patient, and there is not a staff member here to greet me because I didn't call in. That's a good thing. I like that. That keeps us safe. People can't just wander in here unless a staff member has specifically told them to meet them at that entrance.
This is great. This is perfect. I think maybe if you could just give us, are there any other tips for what we can do at home? I guess some random.
Yeah, there are some really great fun things that people are doing as they're getting reacquainted with their family members and friends. And in order to not go stir crazy, we recommend everyone try to take a nice walk each day, maybe right around your neighborhood, not with groups of people. We're still following the social distancing rules to try to minimize the spread of this illness, but get a little bit of exercise every day. It really helps to avoid going stir crazy. There's some great educational programs that people can do online. I can send you the links for some Ivy League education.
Okay.
They can actually take Ivy League courses online if you're an educational buff.
Cool.
Or a nerd like me.
That's
at
great.
home, we still recommend that even though you are within your kind of core group of family members, that you still maintain appropriate social distancing. Washing hands doesn't change just because you're at home. Covering your cough also doesn't change just because you're at home. As soon as you notice signs or symptoms of respiratory illness, cough, fever, body aches, sore throat, call your primary care physician. Call them right away. They're going to have the first line of answers and suggestions of what you should do. If they're not available, call us. We're happy to talk to you on the phone anytime. You can talk to a doctor. You can talk to a nurse. We have patients who have come to us and then traveled around the globe wherever they are in the world, they can call us and talk to a doctor or a nurse about any questions they have. We'll be happy to direct you to the appropriate resources. If you're not sick enough to need to be in an ER, that's okay. With your address, we can help direct you to the nearest resource that will be able to help you. And we don't mind calling your primary care doctor or locating an urgent care for you if that's what you need.
Thank you. That is incredible. That's such an amazing service and such a relief to know that you're in our neighborhood and you're
We're
providing all of these services.
Yes, we are. We've been here for, wow, going on 11 years this year. So we're
Yes.
definitely a part of this neighborhood, and we want everyone to know we're here, we're available. You're protected whether you come here with a respiratory illness or whether you come here with all the other emergency reasons that people have. You're protected and you're going to be safe, and you will not be cross-contaminated from the respiratory patients that we will continue to see for a very long time.
Right. Wow. Well, thank you so much. Thank you for your time and for the tour. And we will have all the links below. And yeah, once again, we appreciate it.
You're welcome. And coming very, very soon, anybody who wants to see a doctor or one of our nurse practitioners through telehealth, if they go to our main webpage, there's going to be a link there where they can now call in and actually have a virtual visit with a physician or a nurse practitioner for $30, which is
Awesome.
really, really great in this time where
Yes.
economics are important. So stay tuned and check out our main landing page at Elite Care in Rice Village for that.
Great. Thank you.
Thanks, Amanda.